Part of our licensing conditions, which we've all been approved for, means that we have to ensure our product is not diverted. So we will cultivate, we will produce, manufacture medicinal cannabis oil that then gets distributed through pharmacies. 90% of what we're producing here does not have a psychoactive ingredient. We are talking about a medicine. The important difference is the genetic profile. We have exclusive plants developed over decades, which, if you can imagine, one plant gets grown properly according to good agricultural practice, extracted, and then can become a medicine for an epileptic child. A different plant has a different genetic profile, and that would be produced for pain management or multiple sclerosis or people with cancer. So really the security measures, which are very important, allow us to get on with the business of producing medicine for Australian patients. You can see the security compound here. You can see the camera poles that are coming in and the razor wire. We're also obviously in a fairly naturally secure area, although we seem like we're in the middle of nowhere. We're very close to hospitals and health precincts here on the Sunshine Coast. As well as that, we have 24-hour security on site. All of our systems go through what is called biometric finger scanning. Whilst we're near completion in the greenhouse, I guess as some people might want to see what's in there, most people want to see what's in there, there's a lot of commercial confidence information, as well as because we've partnered with the global pioneers, we're not guessing our way through this. Sure, we are learning, but we have a template. And I guess if you can imagine, if other companies and interested parties were to see how that was set up, that would affect the commercial capacity and the competitiveness. So it's important that we're just allowed to get on with the business of producing medicine. So we're in the manufacturing side of things. So because we produce oils, tin mill bottled oils, we have an extraction lab here and we have a bottling plant, an automated bottling plant here. So that we can adequately provide for 5,000 patients per year. This is where the secure products get stored in the vaults. So on one side we have what you would call the raw product, which is once it's harvested and dried, it goes there and it's into its secure compound. Can't show you too much more than it's a very heavy steel safe door, and in there's where all the raw material stays, and then when it's needed for extraction purposes, goes through to the laboratory, becomes oil, gets tested, and then all the finished product goes off into the second vault door. The doctors are the gatekeepers. All of us have a doctor. We're familiar with getting prescriptions. There is a template and a distribution channel that we already know, and it already works well in Australia. In Queensland, you can visit a GP or a specialist and they can be given approval. They can get an approval from the health department, as well as the federal TGA will approve them, and they can then prescribe you a Schedule 8 medicine. And for anyone out there who knows medicine, that is a highly controlled substance that is dispensed through pharmacies and already has a secure distribution network. So as a private company, the three other companies that are in the same license category as us, they're public, so of course they're beholden to shareholders, and good luck to them, but we believe it's vital to deliver affordable medicine to Australian patients. This is the first year, so we just want to get it right at home first. We came to market with a local production facility to serve the Australian patient. So, it's all well and good, and it is great to think there's a big export market out there, but in our view, it's vital to help Australian patients first.
We see this industry, which will probably be easily $70 billion worth globally by 2025. We want to see Australia on the front foot leading the charge. And that's why we're delighted that we have companies like Medifarm adopting the compliance necessary and working with world-class intellectual property, because Australia will lead the pack on this. And the better our domestic industry, the better our exports, the more jobs and the healthier Australians will be.